Today topic is osteomyelitis part 2. So in the last class we have seen up to clinical manifestation. So today we are going to discuss about the diagnostic evaluation for the osteomyelitis. So osteomyelitis means it is an infection of the bone and it can be caused by the microbial agents. So the osteomyelitis diagnostic evaluation today topic. So the diagnostic evaluation, it is a history collection and physical examination. So first we should collect the history from the patient and we should do the physical examination. So there is a in this diagnostic evaluation there is a physical examination and history collection. We should collect the history from the patient, and there is a aerobic and anaerobic culture of bone and deep tissues. So from the bone and the deep tissues we should collect the sample and we can keep in the aerobic and anaerobic culture. So aerobic means in the presence of oxygen, in the anaerobic culture means it is a absence of oxygen. So from the bone and the deep tissue we should collect the sample and we can keep in the culture aerobic and anaerobic culture for to know the growing of the bacteria in the body. So it is a aerobic and anaerobic culture of the bone and deep tissues. So aerobic means in the presence of oxygen, anaerobic means in the absence of oxygen. So the culture we can do to collect the sample from the bone and the deep tissues. So it is about the aerobic and anaerobic culture to identify the organism. And next one is Esr elevated and the WBC and HB can be decreased. So Esr means there is a erythrosedimentation rate. So there is a erythrosedimentation rate can be elevated. So in the normal level Esr is in the males 22 millimeters per the hour and in females there is a 29 millimeters per hour. So there is a Esr in females 29 millimeters per hour and in males 22 millimeters per hour. So the Esr rate, sedimentation rate become elevated. So in females it is become 29 millimeters per hour and in males it is 22 millimeters per hour. So in the osteomyelitis the Esr rate can be increased more than the 29 mm per hour. So next WBC and HB can be decreased. So the normal WBC count is 4000 to 11000. So microliters per deciliter and the normal WBC count is 4000 to 11,000 microliters per deciliter. So the normal WBC count and the HB can be decreased. So the hemoglobin levels can be decreased and the WBC count also decreased and Esr become elevated. So the normal Esr rate is 29 mm in hour in females and the males 22 mm per hour. So the erythrosedimentation rate can be increased. And next one is radionuclide bone scan. So used to diagnose the early acute osteomyelitis. So it is a radionuclide bone scan. So to know the early acute osteomyelitis and we can do the radionuclide bone scan. So next one is MRI. So MRI, it is a magnetic resonance imaging and it can be used to identify the any malignancies in the bone or not. So it is about the diagnostic evaluation. It includes the history collection and physical examination and aerobic and anaerobic culture of the bone and deep tissue to identify the organism. And next one is Esr rate become elevated, WBC and the HB can be decreased and radionuclide bone scan used to diagnose early acute osteomyelitis. So, the radionuclide bone scan can be used to diagnose the early stage of osteomyelitis. And next one is MRI, that is a magnetic resonance imaging. It can be used to diagnose the malignancies of the bone. Next one is medical management. In this medical management, there is a administer IV, semi-synthetic penicillin and cephalosporin. So, in this medical management, we can administer the IV injection, that is penicillin and the cephalosporin. So, we can administer these medications by IV route. So, there is a penicillin and cephalosporin. It is a primary treatment for the osteomyelitis. They are penicillin and cephalosporin become antibiotics. So, next one is administer antibiotics for at least 4 to 6 weeks. So, up to 4 to 6 weeks the antibiotics can be administered to the patient to decrease the infection. So, the antibiotics can be given to prevent the infection. So, next one is splinting. So, splinting means this may be necessary to immobilize the affected bone. So, the splinting means it can be support the affected bone. So, it can be necessary to immobilize the affected bone and nearby joint in order to avoid another trauma. So, because of by using this splint, and we can reduce the further trauma and to help the area heal adequately as quickly as possible. So, splinting can be used to heal the wound as quickly as possible. Splinting means it can be necessary to immobilize the affected bone. So, splinting it can be used to support the affected bone and also it can be used to immobilize the affected bone and nearby joint. So, it can be reduce the further trauma. So, it can be reduce the further trauma and it can be helps for the to heal the wound as quickly as possible. So in this medical management there is a antibiotics includes the penicillin and cephalosporin, and there is a antibiotics can be administered at least 4 to 6 weeks. And next one, splinting. There is a splinting can be to support the affected bone and to immobilize the affected bone and near the joint, and it can be helps to reduce the further trauma, and it can be used to help to heal the wound as quickly as possible. So, next one is surgical management for the osteomyelitis. It includes the needle aspiration. So, needle aspiration, by the small incision the needle can be inserted into the joints and we can collect the fluid. So, we can collect the affected fluid and it can be sent for the lab. So, it is the needle aspiration. So, needle aspiration means by the small incision the needle can be inserted into the joints and we can collect the affected fluid and it can be sent for the lab. So, it is called as needle aspiration. And the debridement. So, debridement means there is a removal of damaged tissue or the cells which are present in the bones. So, debridement means it can be removal of the damaged cells or the tissues or the death of the cells. So, death cells can be removed by the debridement. And next one is surgical decompression. So, there is a decompression means it is a removal or reposition of the any structure. So, there is a surgical decompression. So, it includes there is a normal repositioning the normal structure of the bone. So, it can be considered when patient does not improve after 36 to 48 hours of antimicrobial therapy. So, after giving medications, antimicrobial agents, after giving medications after the 36 to 48 hours, if the patient is not able to respond to the treatment and the we can go for the surgical decompression. So surgical decompression means there is a removal or the repositioning of the any structure in the body. So there is a surgical decompression means it can be removal or repositioning of the bone in the osteomyelitis. And next one is complication. So it is about the surgical management. There is a needle aspiration and there is a debridement and surgical decompression. If the patient is not able to respond to the treatment after 36 to 48 hours, and we can go for the surgical decompression. Next one is complications. It includes the bone abscess. Bone abscess means it is become inflammation of the bone. It can be caused by the infection. So it is a bone infection and bone abscess. Next one is bone necrosis. So bone necrosis means there is a decreased blood supply to the bone. Because of this decreased blood supply to the bone, the death of the cells or the tissues around the bone, it can be damaged. So it is called as bone necrosis. So there is a decreased blood supply to the bones or the tissues, decreased blood supply to the cells or the tissues, and it can cause the necrosis, death of the bone tissue. It is called as bone necrosis. There is a bone death of the bone tissue. It can be caused by the decreased blood supply. And next one is spread of infection. There is a spread of infection. So from the joint, the infection can be spread to the other segments of the bone. And there is an inflammation of soft tissue. It is called as cellulitis. So there is a inflammation of soft tissue. It is called as cellulitis. And next one is blood poisoning. So blood poisoning, it is called as septicemia. So if you are not treated the infection, it is become spread into the blood and it is called as septicemia. There is a blood poisoning. And next one is chronic infection does not respond to treatment. So if the chronic infection is present and it cannot be response to the treatment. So it is about the complication in the early stage of osteomyelitis. If you are not treated early, and it can cause the complication. So it includes the bone abscess, bone necrosis and spread of infection and inflammation of soft tissue. It is called as cellulitis and blood poisoning. So it called as septicemia. And if chronic infection does not respond to treatment. And next one is nursing management. In this nursing management, assess the pain and maintain rest and immobilization of the affected part. So the nurse has to be assess the pain levels of the patient and the immobilization of the affected part. So the nurse has to be assessed in the immobilization of the affected part. And next one is administer analgesics. So patient will have the severe pain, so nurse has to administer the analgesics to reduce the pain as prescribed by the physician. And next one is encourage for the fluid intake. So the nurse has to be encourage for the patient to take the more fluids. So by this fluid encouragement, it can be decrease the dehydration. So the nurse has to be encourage the patient to take more fluids to reduce the dehydration. And next one is administer the antibiotics. So to prevent the infection, the nurse has to be administer the antibiotics as prescribed by the physician. And next one is instruct on allowable activities, generally no weight bearing on affected limb. So there is a only limited movements can be allowed and there is a no weight bearing on the affected joint. So there is a no weight bearing on the affected limb, only limited allowable movements can be present. So next one is provide high protein vitamin C and the balanced diet to promote healing. So the nurse has to be encouraged to take the more protein diet and the vitamin C. So if you are taking the balanced diet, it can be helps to promote the early wound healing. So it can be promote the healing of the wound. So the nurse has to be educated to the patient about the high protein diet and the vitamin C, and it can be help for the early healing of the wound. Next one is evaluate response to treatment through the laboratory test. So the patient is giving response to the treatment or not, the nurse has to be assessed and by the laboratory test. So by the laboratory test, and we can assess the nurse has to be assess the patient is response to the treatment or not, we can assess by the laboratory test. So in the laboratory test we can do the ESR test, and the ESR test, it can be elevated, there is a sign of infection. So by the laboratory test we can identify the patient is giving response to the treatment or not, if the disease is curable or not, by the we can identify by the laboratory test. And the teach family and the patient about the oral antibiotics. So the nurse has to be teach to the family and the patient about the oral antibiotics at the home level. So the nurse has to be educate to the family and the patient about the antibiotic therapy at the home level. So it is about the nursing management for the osteomyelitis.